Kia ora, I'm Debbie Webster and I am a Road Safety Coordinator for Horizons Regional Council, which is in the Manawatu Whanganui region. My presentation is on how Horizons supports one local community transport provider in the region. The wrong one. Nope. Sorry, I'm not used to right. That way. Right. Okay, so the Horizons region is relatively well serviced by public transport, with regular urban bus services, total mobility services, and regional services which include what we call specialised transport services. There's supposed to be a ring around the bottom one. These specialised transport services across the region, they have actually evolved, or they've usually evolved in response to a specific community need, and they are subsidised to some extent by Horizons. Under the Land Transport Management Act, they're also defined as excluded passenger services. So the one I'm going to talk about today is the Dannevirke Community Vehicle Service, which is in the Tararua district. So the Tararua district is, for anybody that doesn't know, east of Palmerston North. Dannevirke has a population of about 5,360, that was at 2018, and I think it's growing. The initial steps that we had, or that we took to set up a service, was that we needed to have a meeting, a community meeting, to identify the need and discuss establishing the service. Previously, we'd had a couple of local taxi services in the town, but they'd actually closed down due to the lack of patronage and also the hours that they had to commit to making it worthwhile for them. We had around the table, we had representatives from Horizons, Mid Central District Health, the Dannevirke Community Board and the Tararua District Council, as well as local community members. We surveyed our local grey power and Provis groups to gauge support, and we had an overwhelming number of people said that they would use a service if we provided one. And we trialled a service in Dannevirke based on the Environment Canterbury's model. So we needed to come up with a vision, and that was to provide an affordable transport service that meets the needs of residents of the Dannevirke community. Setting it up, we developed a business plan, and that comes up for a review in 2020. We applied for charitable trust status, and that was approved in 2014, and that meant that we could get, we would be eligible to receive tax-deductible charitable contributions. We sought initial funding from a number of sources, so we applied to the Department of Internal Affairs, Infinity Foundation, the local Tararua District Council, Horizons, and as well as some other local community groups as well. And we were really lucky that a local benefactor gifted a substantial amount for the purchase of a vehicle. So again, like you mentioned, yeah, very well supported by people to purchase like us. Local support was fantastic. Okay, so as I said, we had enough money to purchase a brand new Ford Mondeo, and when word got out there that we needed to build a carport, we had a number of businesses that actually donated time and materials to actually build a carport for us to house the Ford Mondeo. We have our automotive repairs on the Mondeo are subsidised by the local Ford garage. And then in 2018, we actually were offered the long-term loan of a Hyundai Ioniq electric vehicle. So our service actually launched in 2015, and we have 8 trustees as well as a small committee of local people who are either friends of the trust or part of the volunteer driver team. We have meetings every 6 weeks. And those meetings are to discuss a number of things like the financial services, the rosters, and any other issues that might arise. We currently have 29 volunteer drivers, and they work on a monthly roster system. Our volunteer drivers all go through a driving assessment prior to going on the roster, and we offer training around the installation of the 3 child restraints that we actually have available. So we initially started the service at 3 days a week, and we run it from 9:30 till 4:30. In 2018, we increased that to 4 days because the demand was there, and as of January next year, we're actually extending the service to 5 days a week. The initial area of coverage, we started off with offering the service in Dannevirke urban area, and then in September of this year, we actually increased it to include a 20k radius to assist those that actually live rural. The cost of the trips, we charge $5 per person one way or return, and that's for the urban trips, and $20 per person return for the rural trips. And we actually don't have anybody, or we don't get many people that actually complain about that either, so we think it's pretty fair. Again though, if we have somebody, it's kind of we leave it up to driver discretion, so if somebody, it seems like they're in financial hardship, then we actually let our drivers make that decision. Our operating running costs and income. So our bookings are made by the Dannevirke Information Centre, and we have a memorandum of understanding with them. We get charged every month for the fee, and it's reviewed every 2 years. And they do all the things like, they do the bookings, they actually liaise with the drivers, they see to any day-to-day issues around the community vehicle. Our financial services, we have a local accountants that do them, and that fee is reviewed every 2 years. Initially, we actually had a committee member, or one of the trustees was actually doing the financial matters, but then he left, and it was like, who else is going to do it? And nobody wanted to kind of put their hand up, and it's actually quite an involved job. There's a lot actually that it entails. So we've got GST, we've got IRD stuff, and so what we decided to do was we put it out there to a couple of accountants. We got them both to put in a tender for it, and the one that we got, both of them were going to offer it at a reduced rate, but this one also offers it at a reduced rate. Our income, we get a grant from Horizons through the long-term plan, and that actually helps to cover the operating costs. That started off at $5,000 per year for the first 3 years, and it's now been extended to $10,000 per year, and that actually helps us basically stay afloat, because we do get income from trips and donations, but the grant is the thing that actually helps us to actually pay for the booking, the Dannevirke Information Centre and the local accountants, the costs that are involved there. So our total trips in the first year we did 650, and we thought that was pretty good to start with. And then last year we did approximately 1,650. So we're just doing Dannevirke, we're not actually going any further than that. We support the St John's Health Shuttle and take their clients to medical appointments when their shuttles are all busy. So they had a couple of shuttles, I think, and also a car. And if the car, I think, is in Wellington, then we step up and we help transfer or transport clients to local doctor's appointments in Dannevirke. The majority of our clients are seniors, so we're taking them to the grocery shopping. Our drivers also assist them when they do the grocery shopping. They assist them to actually carry their parcels out, and they take them home and take their parcels in for them. So they're kind of offering a companion service as well. We take them every month. We actually transport seniors to Probus and Great Power meetings as well. And we just, just around town, anybody that needs to go to a meeting or wants to come visit friends or something like that, we're available to transport them. We're also getting an increase in younger clientele using the service. So it may be where there's one car family and one partner has the vehicle for work, and so the other partner's at home with the children, or they need to be transported. So we're getting the younger clients. We're also getting clients that maybe don't have a driver's licence, so we can transport them as well. Health and safety, we do have a number of policies and procedures around health and safety. We have an operational policy, safe driving policy and procedures, a volunteer driver procedures, and a hazard register. And we just want to make sure that all our boxes are ticked when it comes to health and safety. Those are all reviewed every 2 years. We also have a motor vehicle accident register and a personal accident register for drivers and clients. So we do face a number of challenges. Not everybody is suitable to be a driver. Okay, so we need to find the right type of volunteer for driving, and what we prefer to do is we prefer to do it by word of mouth or somebody recommends somebody. We don't advertise as such in the newspaper or anything like that, but we do get people coming forward, and we have had one person that we actually had to turn down in a nice way. So yeah, we try and make sure that we've got the right type of driver. The driver availability for the roster. So we know that these people are all volunteers and we want to be as flexible as we can. So we try not to put pressure on them. The completion of daily running sheets. So we need to have our daily running sheets completed properly, and we need to get that is so that we can get the information for later on when we're doing our reporting. So we faced a few challenges on just making them easy enough for the drives to complete. Issues around driving the electric vehicle. So when we first got the electric vehicle, we didn't want to put pressure on volunteer drivers to drive it, and there were a number that were actually a little apprehensive about driving it. So we said, you know, if you want to drive the Mondeo, feel free, you can continue to drive that. However, now we have most of them wanting to drive the EV because they really enjoy it, and we still have a number that are happy to drive the Mondeo, but if they could have a choice, I think they'd go for the EV. And minor accidents with the vehicles and whether to claim insurance or not. So we do have a number of dings and scratches that happen from time to time. And initially we used to claim insurance if it was bad enough, but now if we can, you know, fix it up ourselves. We've had one of our members has just kind of, you know, pushed the bumper out and cut, you know, give it a bit of a rub. So if we can do it ourselves, we will do it, and we'll only claim insurance when we really need to, because we really want to keep our no claims bonus. So looking ahead, well, our cars are very busy. Our bookings can be every 15 minutes, and it's not unusual to do about 70 trips a week. The service has definitely grown since 2015, and we've adjusted the service to meet the demands of our community, and we will continue to do so as the need arises. For our small rural community in Dannevirke, and that's where I live, so this has a real special thing for me, this is an ideal setup, and as long as we can continue to attract volunteers and access the funding, then it's highly likely that our service will continue to grow. Thank you.